All right. Hello, everyone. My name is Megan DePeter, and I am a senior product trainer here at Definitive Healthcare. Welcome to the webinar on how to staff and recruit in a physician shortage. For today's webinar, I'll be covering a variety of different topics. Our agenda this afternoon covers talking about shifts in patient and physician populations while addressing consequences this has on full rotation recruiting. You will learn how commercial intelligence can help differentiate yourself with quality and accurate recruiting, and get a look into our unique staffing dashboard. Before we can even dive into the topic of the physician shortage, it's important to understand there are so many ways Definitive Healthcare can partner with you to address your staffing needs, whether it be business development, credentialing, operations, or recruiting. Potentially even all. People wear many hats these days. Definitive Healthcare's commercial data can help you identify your total addressable market by specialty or geography. We can assist in identifying all candidates' licenses in a target state and specialty. We can help map provider work history using affiliation data, and also can reverse engineer competitor job postings to determine facilities with staffing need. But now that you see how Definitive plays a role in the big picture, let's start with discussing shifts in the patient population. When we start to look at some statistics, we can understand some critical things about the changing healthcare landscape. By 2030, the US is expected to be about 100,000 providers short to meet population demands. Reason being is that while through 2030, the general population is expected to grow 10%, the population over the age of 65 is expected to grow by 48%. This leads to a tip in demographics where the US Census has anticipated that adults over 65 will outnumber children under 18 for the first time ever in 2035. As the population grows and demographics favor a growing and aging public, demands on our healthcare system will expand need for providers serving diverse medical needs. So, what does this all mean? What is there to consider now? The aging nation affects the healthcare workforce and patient demographic. More seasoned providers are retiring than new candidates entering the market. This fuels the physician shortage. Therefore, it's now important to consider the age of patients and providers in your market when succession planning with clients. Looking at this visual on the left, this represents millions of people over 65 of age. By 2060, 1 in 4 Americans is projected to be an older adult. So, what are the other effects of an aging nation? Specialties already facing physician shortages will feel the greatest consequences of an aging nation. Examples being family medicine, psychiatry, internal medicine, NPs, OBGYNs, and hospitalists. With fewer providers caring for more patients, the pressure to find and retain top talent will be felt by both facilities and agencies. So let's look closer into the shifts in the physician market. First look here is at candidate market attrition. The left-hand side shows us the baby boomer share of providers. The right, focusing on millennials. The total number of boomer providers leaving the market reaches over 91,000, while total millennials entering the market is only around 25,000 individuals. So, what can we understand from this here? As baby boomer providers retire, millennials will redefine candidate markets. You can expect to see an increase in physician assistants and nurse practitioner candidates. These candidates will have increasingly complex procedure and diagnostic experience. You'll also see that overall physician attrition has decreased 72% in select specialties since 1970. This, unfortunately, is a trend that is continuing. With the cost of education increasing over 200% and physician salaries increasing only by 10%, the appeal that the medical field once had is affected. And simply put, there are fewer providers also treating more patients. Goes without saying that this creates gaps and inefficiencies in patient care. Now that we understand where the trends are when it comes to physician and patient population, what are the consequences of a physician shortage on full cycle recruiting? We will go through these 4 areas of recruiting: client engagement, sourcing, hiring, and onboarding, and talk about how Definitive Healthcare can help you get a leg up in the market. Starting with client engagement, the demand for top talent is high. Definitive can help you partner with facilities on staffing efficiency to improve quality of patient care. So let's discuss challenges that the hospitals or other firms face. Well, they want to improve quality of care, reduce CMS penalties, increase reimbursements, and attract and retain quality providers. Now, an agency faces challenges as well. And this includes things such as differentiating yourself in a saturated market, building relationships, and similarly attracting and retaining quality providers. So, what is your differentiator? How can Definitive help? Your differentiators are being able to partner with clients on improving hospital compare and quality ratings. With Definitive Healthcare Commercial Intelligence, you can identify workload consequences on burnout and churn and position yourself as a reliable business partner invested in overall hospital improvement. Since those improvement scores have fiscal adjustments tied to them, these are discussion points that make key decision makers listen. This enables you, by using our executive data, to find a network of heads of departments, quality officers, and physician recruiters to provide holistic and comprehensive solutions. Now, another challenge we face is sourcing. With supply low, expect to find fewer candidates on job boards. The average age of physicians as of 2016 was 52 years old. With 30% of providers over 60 and retiring, you'll be sourcing largely Gen X and millennial candidates. You will need to consider technology and speed to market and effective recruiting strategies. I bring us to our physician report builder. Within the Definitive Healthcare Report Builder tool, a user can capture details to help sourcing efforts. For example, one can use the graduation year to target candidates. Locum and travel physicians may be retiring and recent graduates, while permanent placement may be more mid-career providers. Other data fields that you can add into your report range from their credentials, their top indications, board certifications, primary practice location, and much more. These reports are exportable to Excel. Having a single customizable report to work with can help streamline your organization. After looking at client engagement and sourcing, we come to hiring. It's a candidate's market. Providers will be in high demand, especially in specialties that serve older adults. Consider how you position opportunities to your candidates. Providers will be seeking quality engagement with opportunity for growth and competitive benefits. In Definitive Healthcare, with access to the subsequent firm types, you can look at a hospital profile. This will allow you to gather useful information in one glance. Hospital type, market concentration index, size of a hospital, and number of affiliated physicians. Looking at case mix index in a hospital can help determine if it's a good fit for a particular physician, since candidates care about opportunity for growth and exposure to complex cases. On physician profiles, you're easily able to see their primary practice location and link that to Google Maps. This will allow you to determine if the opportunity you have is in proximity to their current desired location. Last but not least is onboarding. With more positions to fill than candidates to fill them, providers can be choosy with offers. Agencies will need to consider ways to shorten the onboarding process to ensure candidates' retention and compete with agency and direct hire opportunities. To improve your speed to market, use Definitive Healthcare to credential candidates efficiently and reduce administrative pre-work for candidates, all by pulling up their caseloads. Again, this will allow you to reduce time to fill and place candidates faster, understanding if they already have some experience in specific therapy areas. Credential physicians with Medicare and commercial claims. Again, export your candidates' case logs to reduce the time and cost of credentialing your providers. Efficient onboarding reduces the risk of losing a candidate to another agency or a direct hire role. Physician credentialing is the process of organizing and verifying a doctor's professional records. This includes board certifications, education, insurance, work history, and more. So much of that can be gathered through Definitive Healthcare. The claims analytics available within Definitive can help lead to the perfect match. One can tailor recruiting efforts to match healthcare provider experience with open job orders. The platform allows you to be ready to answer all your healthcare providers' questions on facility quality and performance. Place your candidates faster and reduce pre-hire administration requirements with accessible case logs. Using the platform, you can also see all opportunities for clients and inform candidates of travel opportunities based on licensures. Now, from a client perspective, present pre-cleared candidates based on procedural history and quality and reduce that client's time to fill. Consult with the facility on staffing best practices to improve hospital quality and increase Medicare reimbursement. Also, identify burnout and churn risk and consult with your client to allocate resources effectively. Now that we walked through some challenges and also some way to use claims for staffing, there's more we want to consider. Let's recap. The average age of citizens are increasing. The availability of providers is decreasing. This means you must identify the needs of your patient population and make smarter matches based on provider experience. So how can Definitive help? When considering a marketing and recruiting strategy, consider the needs of your patient population and trends in their healthcare. Leverage procedure and diagnostic claims to analyze trends in your market and proactively recruit the quality of candidates that your client will actually need. On the left, we see commercial claims, the top diagnosis codes billed in 2020 within the state of New York. This was pulled from a Definitive Healthcare analytic report on the platform. Hypertension exceeds any other diagnosis by double, with kidney failure, hyperlipidemia, and respiratory failure following. Are there enough qualified cardiologists to serve this patient population? These are the types of questions to ask. Now, let's pivot a little bit and how else you can use Definitive Healthcare to recruit and staff in a physician shortage. And that is for reverse engineering job board postings. Imagine that you see a hospital in Iowa and they're seeking a general surgeon who can provide locum tenens coverage. The physician can expect to see patients for a variety of cases, including C-sections and ER consults. The facility uses Epic EMR. Utilizing definitive healthcare hospital searches, we can look for hospitals that fit this criteria. From there, you can leverage procedure claims analytics and services provided to identify facilities in a market with healthcare provider need. One can even match technology data with EMRs listed in the job posting. In this case, we have 3 hospitals shown. Out of 3, only one actually has Epic as a client one actually has Epic as a client with surgical and emergency services provided. So we now have been able to identify who has the healthcare provider need. And after determining opportunities, it's about reaching out to the right people. And Definitive Healthcare has comprehensive executive searches. In the world of MSPs, the executive search helps you directly contact the decision makers for your job. You are able to save searches and contact information for your preferred points of contact. In Definitive Healthcare, you can create an email alert to learn about the new physician recruiters in your territory before the competition. Definitive executive searches can also help you find directors of quality to partner with, to strategize for staffing and retention, from locums to permanent placements, to ensure quality patient care. Even collaborate directly with medical affairs and physician services to get your providers working as soon as possible. A clear and efficient onboarding process will ensure an exceptional experience for both client and candidates. Now, lastly, we're going to discuss something a little bit different, and that is the staffing and recruiting dashboard within Definitive Healthcare. The Staffing and Recruiting Analytics DHC Visuals tool is available as a separate add-on. This dashboard helps to identify staffing opportunities based upon an aggregation of physician affiliations, physician specialties, contract labor, bed utilization, HCAHPS scores, and Medicare claims data. There are currently 3 dashboard tabs available: Market View, Quality Overview, and Physician Targets. The Market Overview dashboard provides a comparison of hospital procedure share and physician share by specialty. Contract labor and bed utilization have also been layered into the data to help better identify staffing opportunities. This dashboard can be filtered by region, state, CBSA, hospital name, predicted locum tenens, primary specialty, physician workload, bed utilization, and contract labor. This section of the Market Overview dashboard is based on both contract labor and bed utilization data. Each circle represents a single facility and is sized by contract labor, with larger ones indicating higher spending, and the color signifying bed utilization rate on a spectrum of purple, which is low, to light blue, which is high. Hovering over any circles in the database will provide a pop-up with key facility data. Looking at the middle here, rankings within this table are generated by leveraging the workload index. This index is a 0 to 1 value and is based upon physician workload, which is the relationship between number of affiliated physicians within a given specialty and the number of claims that those physicians appear on. Therefore, the higher the workload index, the more potentially overworked and in demand these physicians are, and therefore the greater indication of staffing opportunity. Identifying that workload index is key. Overworked facilities may require additional staffing needs or be filled with physicians who are looking for less stressful opportunities. The last section of the Market Overview dashboard will display a physician and procedure market share by physician specialty. By selecting a target specialty, staffing professionals can identify which facilities in their territory are in most need of candidates. Leverage the physician workload metric to understand who is over and understaffed within your territory. Now switching to the last tab that we're going to take a look at, physician targets. While resume sites allow you to access the most up-to-date job seekers, our tool gives you the visibility into the entire candidate market. Identify highly qualified candidates in both passive and active job seeker markets. The physician target dashboard provides functionality based upon a target hospital to design a targeted list of physician pools or individuals that are not primarily affiliated with the target hospital, but rather have a medical license in the same state. Talk about opportunity. This dashboard can be filtered by target hospital, primary specialty, predicted locum tenens, Ivy League, medical school, and more. Again, this will really allow you to have a pool of potential candidates to work with that may have an indication that they are looking for placement or could use some staffing help. Thank you so much today for your time. And if you have any interest in learning more about Definitive, feel free to also reach out to sales@definitivehc.com. Thank you all so much today.